promote cancer prevention. Share ways to reduce general cancer risks. Many cancers are preventable, and this can be achieved by reducing cancer risks. A risk factor is anything that increases a person's chance of getting cancer. As community health workers, we can educate our patients about the risk factors to help them make informed choices and lower their chances of getting cancer. There are two types of risk factors: those we cannot change and those we can change. Let's start with those that the patient cannot change but can manage: aging and genetics. As a person gets older, their risk of developing cancer gets higher. One way to manage this risk is by having regular screenings to detect cancer early. Talk to your patients about the appropriate screening tests for their age. Genetics also plays a role, as cancer is caused by changes in the DNA of cells. Although cancer can't be passed down from many generations to your parents, a genetic change that increases the risk of cancer can be inherited. Find out if your patient has a family history of cancer, and if so, recommend screening or, if available, have genetic testing. Now, let's look at the risk factors that patients can change to lower their risk of cancer. Here's an example of how you can help a patient make small, healthier choices every day to lower their cancer risks. Instead of reaching for a cigarette, encourage the patient to stop smoking. Smoking, breathing in someone else's smoke, and tobacco can cause many types of cancer. Remind them to apply sunscreen before going out. Exposure to the sun can cause cancer. If they work outdoors, encourage them to stay out of the sun and wear a hat. If the air pollution is high, suggest wearing a mask for protection. Recommend that the patient avoids high levels of radiation, as this can increase their risk of cancer. Radiation is energy that travels in waves and is commonly released by nuclear power or some medical equipment. Discuss ways to stay away from cancer-causing substances such as asbestos and pesticides. This can involve wearing protective clothing such as masks or gloves. Propose ways to stay active during the day, like walking during lunch breaks. Regular physical activity helps maintain a healthy weight and reduces cancer risks. Encourage eating a healthy meal with plenty of fruits and vegetables. This helps prevent obesity, a risk factor for many diseases, including cancer. Suggest that they drink clean and safe water instead of alcohol, as this increases the risk of cancer. Stress the importance of having vaccinations, especially for the human papillomavirus and hepatitis B, which are linked to certain cancers. Remind patients to attend regular medical checkups so that illnesses such as HIV and diabetes are diagnosed early and treated. These can increase the risk of certain cancers. Your patients may not always be open to changing their behaviors. This may take time, so be patient. Keep communicating and encouraging them to make positive health changes and lower their risks of cancer.